Let's apply this information while looking at the specific subjects and practical applications. When we consider subject number 4, vein presentation, we see a young female of average size with no visible superficial veins in the green zone. Without a good pre-assessment, what would a generalist nurse do? Probably insert in the hand, wrist, or dorsal aspect of the wrist. Following an ultrasound assessment on the right cephalic, it was identified with a diameter of 1.2 millimeters without a tourniquet and 2.0 with. In this case, the starting velocity of 4.3 centimeters per second was measured before a 22-gauge catheter was placed. The velocity increased after placement to 6.1 centimeters per second. The catheter filled approximately 75% of the vessel and represented a high risk for failure due to the poor catheter-to-vein ratio. The volume of blood moving through this vein was calculated at 4.14 milliliters per minute. A valve is distal to the tip of the catheter without catheter contact. During the flushing process, retrograde blood reflux, turbulence, and vein collapse was noted due to pressure changes. It was determined that this vessel size and velocity was adequate to achieve greater than 3 milliliters per minute of flow. Taking into account a rate of infusion at 80 milliliters per hour, the hemodilution ratio is optimal at 3:1. But when infusions increased above 80 milliliters per hour, up to 125 or 250, the ratio of blood flow falls below the optimal 3:1 and down below 2:1. As you can imagine, with larger infusions such as vancomycin requiring 250 milliliters per hour, this can create a problem for the vein in order to accommodate and reduce irritation to the vein. Pre-assessment of this particular patient could identify this vein as suboptimal and recognize another option of a larger or upper arm vein that would be a better selection, allowing the patient to avoid multiple attempts by the bedside nurse or emergency department clinician.